Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Ghulam Nabi, Professor Anesthesia, Khairpur Medical College, Hospital Khairpur. Today I will present Cardiac Cycle Physiology. Many of my students requested me to upload this presentation because I have been teaching them since a long time. So now it will be available on YouTube for everybody to get benefit. So the topics to be discussed today are: I will describe the definition of cardiac cycle, I will discuss the systole and diastole. Third point to be discussed will be relationship of ECG to the cardiac cycle. Fourth point is function of atria as a prime pump. Fifth is timing of cardiac cycle. The sixth will be pressure changes in atria, the appearance of A, C, V wave, and X and Y descent. The seventh point will be atrial systole, and filling of the ventricle will be the eighth point, which contain 4 phases of ventricular diastole. The ninth point will be emptying of the ventricle, which contains 2 phases. So there will be 7 phases of cardiac cycle, which we'll discuss in detail. The 10th point will be the End-Diastolic Volume, End-Systolic Volume, and stroke volume output and ejection fraction. These are the terms which are used frequently during cardiac output and cardiac physiology. So what is cardiac cycle? The cardiac cycle is the cycle that occurs from the beginning of one beat to the beginning of the next beat. This is cardiac cycle. It's equivalent to one heartbeat. Cardiac cycle comprises 7 phases from atria to ventricle. The first phase is atrial contraction. The second phase is ventricular relaxation, which comprises 4 stages. We will discuss in detail. I am showing this diagram, which shows 6. We will discuss the 7 in detail. Ventricular diastole comprises 4 stages. First stage is isovolumetric or isometric relaxation, and the second stage is rapid filling. The third stage is shallow filling or diastasis. The fourth stage of ventricular diastole is rapid filling. So first stage for atrial systole and 4 stages of the ventricular diastole. Then ventricular systole has 2 phases. One is isovolumetric contraction, and second phase is ejection of blood into aorta. So we'll discuss in detail. The cardiac cycle is initiated by action potential in the SA node, which is a pacemaker, and this travels from SA node through the atria, through the 3 bundles spread in the muscle of the atria to AV node. There are 3 names of these bundles: Bashman, Wanky-Bank, and Theoral. These are 3 bundles. And sometimes there is a 4th bundle, which is known as the bundle of Kent, which can cause the Wolff-Parkinson-White syndrome. Theoral is posterior, Bashman is anterior bundle, Wanky-Bank is 3rd bundle. Then the conduction comes in the AV node. Passing from SA node to AV node, there is a fibrous band which causes delay. This delay is very important for the contraction of ventricle. It gives time to contraction of ventricle. If this bundle is not available, atria and ventricle can contract simultaneously. This allows the atria to contract ahead of ventricle and pumping blood into the ventricle before the ventricle contract. Thus the atria act as a prime pump for the ventricles, and the ventricle work as an actual pump. Now what is diastole and what is systole? These are 2 terms commonly used. The cardiac cycle comprises 2 phases. One is the relaxation phase, and the second is contraction phase. When we talk of the diastole or systole, we are talking about the ventricle, especially left ventricle. So the relaxation phase is called diastole, the contracting phase is called systole. The total duration of cardiac cycle, if we calculate, is a 60 beats per minute, which is the borderline for bradycardia. Each cycle will be of 1 second. If we have to divide 60 by 60 minutes, so it will be 1 second will be the value for 1 beat. But the normal heart rate is around 70 to 75, and if we make it 75 as a heart rate and we divide it by 60, the heart rate comes to be 0.8 seconds. So this is the diastolic time and systolic time, both combined 0.8%. And now we have two chambers, atrial systole and ventricular systole. I will discuss in the next slide about the atrial and diastole and their timings. What are the relationship of ECG to the cardiac cycle? ECG shows P, Q, R, S, T waves in the electrocardiogram. They are the electrical voltage generated by the heart and recorded by ECG. The P wave is caused by atrial depolarization, and this is followed by atrial contraction. There is a delay of about 0.16 seconds after the onset of P wave. When the ventricle contracts, the QRS wave appears. The QRS wave appears in the ECG. Then the ventricle starts contracting. QRS complex appears slightly before the contraction because this is electrical current. The contraction starts after the current is passed to the ventricle. Finally, there is a T wave in ECG. This represents the stage of repolarization of ventricle. So this diagram can show you the P wave. The P wave is earlier ahead of atrial systole. So the first electrical activity is generated, then it starts contracting, then it shows the wave on the ECG. And you can see the diastole for 1 second. This is atrial systole. For 0.7 seconds, there is atrial diastole. If you see the ventricular systole, the QRS complex appears before the ventricular systole. So by this means electrical generation first and then contraction. So there is a time lapse. So I hope you understand this. Then the function of atria as a primer pump. When the atrioventricular wall open, because of the decrease in pressure in the ventricle, left ventricle and right ventricle, drop of the blood pressure less than the atrial. In other words, when the atrial pressure is more than the ventricle, the atrioventricular wall opens and blood rushes into the ventricle. This is common with the ventricular diastole. The ventricle is relaxed. This pressure is going towards 0. When it reaches 4, 5, 6 or less than atrial, it opens the AV valve and most of the blood is rushed. There is already around 50 ml of End-Systolic volume available in the left ventricle, and this 50 to 60% blood is aided. So it becomes almost 100 ml. And then there is a second stage of diastasis, in which there is a continuous flow of blood in the ventricle. And then the third or fourth phase of the ventricular diastole, when comes the atria contacts. When the atria contacts, it pushes the remaining 20% towards the ventricle, and then the ventricle start contracting and the atrioventricular wall is closed. This is known as an atrial kick. So the atrial kick is very important in some cases, but in normal healthy person, atrial kick may not have the significant effect, because the heart is working 300 to 400% more than the requirement of the body. So the filling of ventricle will not be affected in healthy person. Even some people don't know they have the loss of atrial kick. But in some, we don't want to go into pathology, but it is not significant in young people. So timing of the cardiac cycle, if you presume the cardiac cycle is 0.8 seconds, the atrial events and ventricular events, if we divide in two phases, in atria, all events divided into two. Atrial systole is 0.1 second and atrial diastole is 0.7 second. For 0.1 second, this atrial kick appears, and then the atria is like a venous conduit or venous reservoir. It is totally relaxed, no pressure inside, 0 to 4, 5 or 6 sometimes. So it is totally relaxed for 7 seconds, prolonged period. And in ventricles, the contraction period is 0.3 second. For first 3.3 seconds, the ventricle contract, and then for 0.5 seconds there is a diastole and continuously relaxation. This diagram can show easily and can make you understand. If you see the atrial inside the circle, there is cardiac cycle. The second round is the atrial systole, and then there is 0.7 second of diastole of atria. If you see the ventricular, the third circle in this diagram, ventricular systole is of 0.3 seconds, and for 5 seconds there is no contraction in the ventricle. So if you see, half of the time there is no activity. For 0.4 seconds there is no activity in the heart. It is totally relaxed, and no pressure changes. It's not contracting for half of the time. It's 0.4 seconds, and for the fifth 0.1 second the atria contract, then 0.3 second the ventricle contract. I hope you understand the timing of the cardiac cycle. Then pressure changes in atria, which can be evident from central pressure line. So it appears as A or alpha, C and V waves, and two descents which are X and Y descent. So the A wave appears when the atria contracts. The pressure is 4, 5, 6 millimeter mercury, and this pressure of the blood when the atria contracts is causes EAV. C wave occurs when there is a bulge, when there is a contraction of the left ventricle or right ventricle, and there is a backward flow towards atria. There is some blood already available, and this push bulging of the atrioventricular wall causes a slight rise in pressure in the ventricle, which comes in the diagram of atrial pressure as a C wave. The V wave results from slow flow of blood into the atria from the veins, while AV valves are closed during ventricular contraction. Now ventricle is contracting, AV valve is already pushing or bulging in the ventricle, but this C wave appears due to rush of blood from pulmonary arteries, and it appears due to right atrial pressure, when the blood comes from superior and inferior vena cava. So there are three changes especially, and that will come in our discussion, and we want to discuss before we reach there. And then the X and Y descent. The X descent appear in mid-systole. This is due to when the atria relax, the bulging wall of atrioventricular wall comes down. It's not open, but it comes down. Then there is a X descent. Y descent is an early diastole when early ventricular filling occurs, when all the blood is ejected into the ventricle. So in this diagram you can see atrial filling, A wave, C wave, and after C wave there is X descent, and then V wave, and then Y descent, which is the emptying of the ventricle. When all the blood goes into the ventricle, this Y descent appear. Now we will discuss the 7 stages or 7 phases of cardiac cycle, and according to guidance physiology, it is atrial systole. I have given the phases because most of the time clinicians give it a number, phase number 1. So if you go through the phases, easy to understand, but it's easy again if you say it atrial systole, which is for 1 second, and atrial diastole, which is for 7 seconds. So the atrial systole is the last phase of a ventricular diastole, during which ventricular filling is completed. Ventricular filling is completed by this atrial kick. This occurs due to depolarization of SA node. SA node is appeared in right atrium. It causes P wave, in the ECG, and duration of this kick is 0.1 second, this contraction is 0.1 second. Pressure in right atrium at that time is 4 to 6 millimeter of mercury, which is maximum, and left atrium it is 7 to 8. If you see this diagram which shows the curves, I will discuss these curves, waves in each phase of the cycle to make you understand where what is happening. The first upper curve is wave is of aortic curve. The second red one is the ventricular pressure curve, and the third is atrial pressure curve, and the fourth curve, which is green or blue in color, which is showing the volume in the ventricle. So during atrial systole, aortic pressure is 80, and ventricular pressure, this red line, is 0, near 0, maybe 2, 3, 4, 5. So if you consider like this, making the pressure during the diastole as a 0 is easy to understand. But before reaching 0, there is opening of the valve, and that causes the pressure. So the third point to be discussed is there is a wave which appears in the atrial pressure. And the fourth point is time is 0.1 second. Fourth point is a P wave in ECG, fifth point. And then fourth heart sound may be heard in left ventricular hypertrophy. The volume at that time when the atria is contracting is around 120. The next phase is ventricular diastole. It contains 4 phases: phase 2, phase 3, phase 4, phase 5. Phase 2 is isometric relaxation, and phase 3 is rapid filling, slow filling, and then lastly the rapid filling. So we will discuss each one by one. The first phase is isovolumic relaxation, and isometric relaxation means there is no change in length of the muscle fiber, and there is no change in the volume of the left or right ventricle, and the heart start dilating and relaxing. The pressure drops, and this pressure drop prevent the backward flow from aorta because they are one-way valve. The time duration for this is 0.03 to 0.06 second. The ventricular muscle continues to relax. Intraventricular pressure falls back to their lower diastolic value, which is near 0. When it decreases below the atrioventricular wall pressure, the atrioventricular wall open, both atrioventricular wall open, and this is the second phase of the cardiac cycle, but the first phase of the ventricular relaxation. When the valve open, the second phase of ventricular relaxation starts. So what happens in this diagram, you can see all 4 valves are closed, and the ventricles are closed cavity, and this stages are 0.08 seconds. No change in volume, no change in length. Pressure falls from 80 towards 0 to open the atrioventricular wall when it reaches 5 to 6 millimeter of mercury. Pressure changes and volume changes in isovolumetric relaxation. So we will discuss each curve one by one. First about the aortic curve. In aortic curve, the pressure is 80 millimeter of mercury, and there's a dichrotic notch appears at this level. And ventricular pressure, second curve is red. Ventricular pressure falls from 80 to near 0. In this, the ventricle is dilating and relaxing. The pressure falls towards 0 till the valve open. Volume in the ventricle is End-Systolic Volume. The blood the heart has pumped already 70 ml of fluid and blood, and now the remaining blood in the ventricle is End-Systolic Volume, which is 50 ml. And T wave appears in ECG, which is sign of relaxation. Second heart sound is audible due to closure of semilunar valves. The volume in the heart is 50 ml, and by this all the stroke volume is ejected. Now we will go to the second phase of rapid filling and phase 3 of the cardiac cycle, which is comprises of 0.011 second. When pressure in the ventricle becomes less than atria, the mitral and tricuspid valve open, and the second phase of ventricular diastole start. Because of the rising atrial pressure due to collection of blood from 0 to 4, and this occurs because of ventricular pressure falling towards 0 from 80 towards 0. So when it reaches less than atrial pressure, the valve open. As the valve open, the blood is rushed to the ventricle, and this is called period of rapid filling. So maximum blood is running towards the heart, and because there are good time lapse to the atria to fill it, and pressure was 5, 6, 7 sometimes. As soon as the ventricular pressure falls below the atrial pressure, the AV valve open, blood flows rapidly. The semilunar valve are closed. If you see the diagram of the waves and curves in the second phase of ventricular relaxation and third phase of the cardiac cycle, and if you see the first wave is aortic pressure wave, in this the pressure is 80, fall down to 80, and the valve is closed. Ventricular pressure remains low, near 0, because the heart is not contracting, heart is totally relaxed, the blood is pouring from atria to the ventricle, and this is a rapid filling phase. And when the blood is going in, the heart is still relaxing, decreasing the pressure more towards 0. Volume in ventricle increases from 50 to 100 ml in this phase. So around 2/3 of the blood of total volume and diastolic volume, the blood is collected in the ventricle by this rapid filling. And this is the time of complete relaxation and diastole. So T wave appear in ECG, and third heart sound may be heard due to rushing of this blood. Phase 3 of ventricle and phase 4 of cardiac cycle, which is diastasis. Diastasis means there is no activity in the heart at all. Atria is relaxed, ventricle is relaxed, and all the blood coming from superior vena cava, inferior vena cava, coming to the atria, and it's going all the way to the ventricle. These all are one chamber. There is no movement. Movement is by venous return. The only active stage, this is the activity, is venous return is coming back to the superior vena cava, which is connected and open. Atrioventricular valve is open. It is filling. So there is slow filling. 1/3, maybe 20 ml, 30 ml blood is collected in this, 10 to 20 ml collected in this time. So it is called diastasis. It's a period of full relaxation of atria and ventricle. Then this stage continues, and the pressure changes in this phase are aortic pressures again at 80, ventricular pressure is going towards 0, wide descent appear in atrium, small amount of blood flows to the passively to the ventricle. Veins, atria and ventricles are one chamber now. Now the last phase of the ventricle starts in both ventricles, of course. This is known as the atrial kick. And during the last third of the diastole, atria contract and gives an additional thrust to the inflow of blood into the ventricle. This accounts for 20% of the filling of the ventricles during each cycle. So atrial kick is the last activity in ventricular diastole to fill it. If you see the diagram of the left intraventricular pressure and left ventricular volume, this is showing all the stages of ventricular relaxation and contraction. And this is a little earlier because we did not discuss the ventricular contraction, but here we can see in the diagram, if it starts from phase 1, the volume in the heart is 50 ml. And when this phase finishes, the wall, the volume reaches to 120, and this is called period of filling. Simply period of filling. Then the second phase starts. This is isovolumetric contraction. Isovolumetric contraction, the pressure increases and there is no increase in volume and no increase in the muscle length or decrease in muscle length. Then the third period of ejection starts, which is at the 80 millimeter of mercury, when the pressure reaches the left ventricle at 80 millimeter of mercury, the semilunar wall open and the blood is pumped into the aorta. So it opens at 80 and is still contracting. The blood pressure go high to the 120 millimeter of mercury. I will discuss this point of wind castle phenomena in the end of this presentation. Wind castle phenomena, when the wall is open at 80, why it is going to 120 and continuously going to 120 and then comes to 80. So during this phase, this period of ejection, the fourth phase is isovolumic relaxation. In this period, all the volume which is taken by the heart is lost, which is 70 ml. It is ejected. Again, the volume is 50, and the pressure is, and the intraventricular pressure is around 100 or 80 or 100. So this diagram will be clear when we finish the ventricular systole. So now we are coming to the emptying of the ventricles. These are the terms used by Guyton, emptying of the ventricles, and it has two phases, which we say is cardiac cycle phase 6 and cardiac cycle phase 5. But ventricular systole has a two phase. One is isovolumic contraction, and the second is period of ejection. The isovolumic contraction, the time duration is 0.05 second, and ejection period has a time of 0.22 second. So we will start with the first phase of period of isovolumic contraction, meaning no change in volume or length of the muscle fiber. Immediately after ventricular contraction, intraventricular pressure increase. This causes the blood to flow back to the atria, but as the atrioventricular wall are one way. So this backflow closes the wall. This backflow closes the wall by a force and by a sound which is known as a first heart sound. Atrioventricular wall closed and first heart sound is produced. And its time duration is 0.0 to 0.3 seconds. And then there is an increase in pressure till the aortic and pulmonary valves are open. The pressure required in pulmonary valve is 8 to 10, and pressure required to open an aortic valve is 80. This is approximate figures, average figures. The blood cannot go back. The only way to go is through the aorta, and aorta has a high pressure. It will not go in the aorta until the ventricular pressure goes higher than 80. So in this isometric contraction, there is no change in volume, there is no change in length of muscle fiber. It is contracting and increasing the pressure till it reaches the 80 and valve open. This is the end of isovolumic relaxation. If you see in the diagram, this is self-evident, and if you read this, time is 0.05 seconds, all four valves close, pressure rises to 80, no change in volume, no change in length muscle fiber, and diastolic volume is now 110 to 120 ml. Now heart is fully filled, and it's end of diastole. Before opening the valve, the volume is 120 ml. If you see the curves, what is happening in the all chambers of the heart, what is happening in the aorta, ventricle, atrial pressure and volume. Aortic pressure is 80 millimeter mercury, and ventricular pressure rises from 0 to 80 millimeter mercury to open the valve. The volume in the left or right ventricle is 120 mils, no change in volume. QRS appear in ECG. This is contraction period of the heart, and first heart sound is produced due to closure of AV valve. Second phase of the ventricular contraction is period of ejection. So the ventricular systole has two phases. One is period of isovolumic contraction, and second we are discussing now the period of ejection. As the pressure increased by the isovolumic contraction of semilunar valve, aortic and pulmonary open, there is a fast ejection of blood from the ventricle to the aorta and into the pulmonary artery. So immediately blood is poured out of the ventricle with about 70% of blood emptying occurs during the first third of this period of ejection, and remaining 30% emptying within 2/3. Therefore, the first phase is called period of rapid ejection, and the second phase is called period of slow ejection. And this pressure still goes high, more than 80 to 120 millimeter mercury, because the heart is still contracting to increase the pressure. If we see the condition of the heart, this diagram shows the duration is 0.22 seconds. Both semilunar walls are open, aortic and pulmonary, and blood is pushed in circulation in two stages. First is rapid stage, ejection 0.13 second. Second period of slow ejection 0.09 second. And the pressure in the aorta is 120 millimeter mercury and 25 millimeter mercury in the pulmonary artery. We can see in this diagram the pressure waves. Aortic pressure rises from 80 to 120 millimeter mercury, then falls slow ejection to 80. Ventricular pressure also rises from 80 to 120 millimeter mercury and falls to 80. Pulmonary artery pressure is 25 millimeter mercury. X descent appear in the atrial waveform. Volume in the ventricle falls to 50 ml at the end of this cycle, because 70 ml is pushed. Now remaining is 50 ml, which is known as End-Systolic Volume. ST segment in ECG appears, and T wave appears in the second half of ECG, which shows relaxation. Now we'll discuss a few terms like End-Diastolic Volume and End-Systolic Volume, stroke volume, and ejection fraction, which are commonly asked and understood and discussed. End-Diastolic Volume is a volume in the ventricle at the end of diastoles. As the name is End-Diastolic Volume, when at the end of diastole, how much volume is in the heart. This means when the heart is fully filled with the blood, how much it is how much blood occupies the heart. This is 110 to 20 ml. This can vary from in some pathological condition or in exercise from 70, it could be 70 ml if the heart is pumping fast, or it could be 130, 140, 180, even 180 milliliters in some condition. And systolic volume is a volume of blood that remains in each ventricle at the end of systole. The name is indicated. At the end systolic volume means what is the volume of blood at end of systole. End of systole means when the heart contracts, it gives off 70 ml as a stroke volume, and the remaining is 50 ml. So this is the end systolic volume. And then the stroke volume output. Stroke volume is the volume of blood ejected per ventricle at each contraction. It's about 70 ml. Ejection fraction is a little confusing to many people. It's a simple calculation. How much percentage of blood is ejected by the ventricle by each contraction. The fraction of end-systolic volume that is ejected is called ejection fraction. It can be calculated by a simple formula. It is almost 60% of the blood ejected, because 120 is end-diastolic volume and 70 volume stroke is given, so it remains is the ejection fraction will be 70%. There is a formula which is the end-systolic volume minus end-diastolic volume divided by end-diastolic volume. If we divide end-systolic volume is 50 and end-diastolic volume 120 is equal to 70. When we divide it by end-diastolic volume, it becomes 0.58. So it's around 50. And there are categories of ejection fraction. Sometimes ejection fraction comes down because of the failing heart, and we take it in grades of ejection fraction 45 to 60, grade 1, 30 to 45, grade 2, and less 3 is grade 3, which is a failing heart. And as an anesthetist, we have a problem of maintaining the cardiac output. When the cardiac output is low, stroke volume is very low because of many reasons. We don't want to discuss pathology. I hope you understand the ejection fraction. This is the diagram which shows all the variables at one time. The top variable is aortic wall, we discuss, the aortic valve pressure in all the 7 phases of the heart. The second red line shows the ventricular pressure. We discuss all the pressure in the ventricle at all the 7 phases of the cardiac cycle. Then there is a atrial pressure wave, and A, C, V, and X, Y descent. We discuss it in all 7 phases of the cardiac cycle. The fourth is like below, and it shows the volume curve in all the phases we discuss. The fifth is ECG. Of course, we have discussed all the P, Q, R, S, T. The fifth is again a phonogram showing the sounds of the heart. First sound, closure of AV valve. Second sound, closure of the semilunar valve. Third sound and fourth sound. S1 and S2 are easily audible. Third and fourth needs expert and need some practice, but in some diseases third and fourth sound has a significant value. So the sound, bigger sound, loop is always produced by the closure of the valves. Opening of the valve is usually passive and slow and does not produce more sound. This is the description of the 3 curves. Fourth curve left ventricular time, fifth curve echo, and sixth curve phonogram. Now the last point to discuss is the Ventricles effect in aorta. As we discussed in our discussion, when the pressure reaches to 80 millimeter of mercury in the left ventricle, the valve opens. Now the pressure has to be dropped because there is outflow to the blood. When the blood is ejected, the pressure has to be dropped, but the pressure does not drop. Even the heart is contracting, blood is going out, the blood pressure should drop. The blood pressure is not dropping. This is because of the elastic recoil of the aorta, and aorta works as a second heart. Aorta works here as a second elastic structure which expands and accommodates all the blood of rapid ejection in the aorta root, and it moves down to the arteries as a wave of the pulse. So the heart works as a first heart, and the aorta works as a second heart. The pressure, when the ventricle is contracting, pressure goes to 120. This is called Ventricles. And if you see this diagram, it's very clear how the aorta works as a second heart. The second diagram, you can see how the aorta is expanding and moving this wave down. This is known as a Ventricles. This is the reason why the pressure does not drop when the valves are open. So ventricles are contracting, blood pressure goes to 120. So this is the action of the aorta, which is elastic fixture. Thank you very much for listening my video, and please share with your friends, like it, subscribe it. And this is a work for my second year student, and other specialists can get benefit if they are interested to listen to this, anesthesia especially, even the student for cardiology. This is basic and primary of the cardiac cycle. Now, it's not a big thing, but for primary it's a new thing. So thank you very much. Jazakallah khair. Pray for me. Khuda Hafiz.